So, in my last video, I told you that a SMART scale revealed that my vascular age is 67. I'm 59. That means my arteries are aging 8 years faster than I am. So, that number, 67, that led me to do something that most people never do. I got a coronary calcium score test, and what it revealed changed everything. This is episode 2 of my Vascular Age Wake-Up Call series. And if you haven't watched episode 1, you might want to go back and watch it because this will make a lot more sense. But we're here now. So let's talk about what happened when I went from my scale says something's wrong to I have a diagnosis. So after I saw that vascular age of 67, I knew I had a choice. And the choices were that I could ignore it. I could tell myself it's just a scale, and what does it know? I could wait and hope that I don't develop symptoms, or I could find out more, like get an in-depth look and see what's actually going on, if anything, with my arteries. I chose to find out. When I started researching vascular age, I learned that it measures arterial stiffness. Arterial stiffness is usually caused by plaque buildup, atherosclerosis. So my arteries were stiff enough to register at 67 years old when I was only 58 at the time. That was 2 months ago. I'm 59 now, which means that there's probably plaque in there. Here's the thing, probably for me isn't good enough. I need to know how much plaque, where is it, and what's my actual risk? Not what's the number on the scale, but what is my actual risk? So fortunately for me, I have a friend who told me about the coronary calcium score test, which is a CT scan of your heart. It's non-invasive, no needles, no contrast dye, no prep. You don't have to fast, nothing. You lie down, they take pictures of your heart. It measures the calcium deposits in your coronary arteries, and that's it. Here's the thing. Calcium deposits are a marker for atherosclerotic plaque. If you have calcium in your arteries, you have plaque. It's very simple. The more calcium you have, the more plaque you have. And the test gives you a number, your score. And that number tells you how much atherosclerosis you actually have. 0 means there's no detectable plaque. That's ideal. That's what you want. Anything above 0 means that there's plaque in there. So I decided, okay, I need this test. I need to know. So here's what happened when I started telling people that I wanted to get this test. The resistance was kind of surprising, to be honest with you. I had friends, acquaintances, people around me who were like, oh, don't panic. It's probably nothing serious. And when I talked about the reading on the scale, I heard a lot of, oh, well, it's just a scale. And someone else told me, oh, well, a lot of people get stents. It's really no big deal. Another person said like, oh, wow, like I was making such a big deal out of it. And it was really nothing. Look, I get it. I do. I get it. They weren't just trying to reassure me, although they were more trying to reassure themselves. Of course, they didn't want me to worry, but really, they didn't want to worry. But here's the problem with that type of reassurance. It's dismissive. The like, okay, go ahead and check, but I'm sure you're fine, feels a lot different when you're talking about your heart. And this sort of like, oh, it's no big deal, that sort of thing, that minimizes something that could be really serious. And ladies in particular, that minimizing is really dangerous. So here's the thing. Women's heart disease symptoms often get dismissed by doctors, by family, and even by the women themselves. You hear things like, oh, you're just stressed, or oh, you're probably fine, or you don't have heart disease. You're too young to have heart disease. You look great, but the stats don't lie. Heart disease is the number 1 killer of women, not breast cancer, not lung cancer, heart disease. And most women don't even know they have it until they're literally having a heart attack. So when people told me, oh, don't worry about it, it was really difficult for me not to hear like, oh, just don't trust yourself. I am not willing to do that. I'm not willing to ignore a sign just because it makes other people uncomfortable. So I made the appointment. I scheduled the test. I decided to trust my gut, not their discomfort. So if you're watching this and you've had people dismiss your health concerns, please hear this. You know your body. You know if something feels off, and you have every right to investigate it. Please don't let anyone, not your friends, not your family, not your partner or your coworkers, or even your doctor, talk you out of advocating for yourself. Because here's the truth. It's your body. It's your life. You are the one who has to live with the consequences of ignoring warning signs, not them, you. So if something doesn't feel right, if you just feel like, gosh, I feel like I should get this checked out, please go get it checked out. Get the test. Okay. So back to that test. So what is a coronary calcium score? Okay, let me explain what this test actually is, because most people have never heard of it. A coronary calcium score test, also known as a CAC scan or a heart scan, is a specialized CT scan that looks at your coronary arteries. Your coronary arteries are the blood vessels that supply blood to your heart muscle. Okay, there are four main arteries: the left main, the left anterior descending, the circumflex, and the right coronary artery. When you have atherosclerosis, well, that's plaque buildup, that plaque often calcifies over time. It hardens, and then the calcium shows up really bright on the CT scan. So the scan measures how much calcium is in each of your coronary arteries, and it all adds up, and that is your score. Now, the test itself, super simple. No needles, no injections, no fasting needed. Okay, you just show up, take off any jewelry because no metal allowed because it's a CT scanner. You might have to change into a gown. You lie down on the table. They put electrodes on your chest to monitor your heartbeat because the scan needs to sync with your heart rhythm. Okay, so the table slides into the CT scanner, and then you just hold your breath when the machine tells you to. Not long, it's like 10 seconds while they take pictures. Okay, that's it. And in like 30 seconds or a minute or so or whatever total, you're done. No pain, no discomfort. Just, maybe you feel a little weird lying there holding your breath for like, listening to the machine while it hums, while it takes pictures of your heart. Anyway, so the results come back. Mine did. They told me it was going to be 24 to 48 hours. And those results, they tell you exactly how much plaque you have. Okay, so the question everybody asks is, if this test is so simple, and if it's so fast and so informative, why don't doctors order it routinely? This is a good question. And the answer is, it's complicated. Okay, so first, there are medical guidelines. Current medical guidelines don't recommend calcium scoring for everybody. They recommend it for people who are at intermediate risk for heart disease. So what does that mean? Well, it means depending upon your age, your cholesterol, your blood pressure, whether or not you smoke, whether or not you have diabetes, and your family history, like you add all that up and it gets calculated into a risk score. And if your risk score is low, the guidelines say that you don't need a calcium score test. But here's the problem. I would have been categorized as low risk. I'm 59. I've exercised my whole life. My blood pressure is normal. I mean, maybe high normal, but normal. I don't have diabetes. My cholesterol is fine. So on paper, I'm low risk, but my calcium score was 63. That is not low risk. That is early atherosclerosis. So those risk calculators, they missed me. And my feeling is they miss a lot of people, especially women. So the second issue that this is complicated is insurance. So in America, at least, most insurance companies won't cover a calcium score test unless you have symptoms or a doctor can justify it based on your risk factors. So even if you ask for it, your insurance may say no. But if you want it anyway, you can pay out of pocket. It's usually around $200. Sometimes you can find it less. You can find deals. Like I know that there are Groupons floating around out there that can get the cost down to like $119. But a lot of people can't or won't pay $200 or $119 or whatever the cost of it if their doctor doesn't order it and their insurance won't cover it. So they don't get it. Okay, the third issue is doctor inertia. And this is difficult because if something isn't in the standard protocol, a lot of doctors don't think about it. And it's not that they're bad doctors and it's not that they don't care. It's just that they're busy and they're seeing patients back to back and they're following guidelines and they're doing what they were trained to do. And if the guidelines don't say order a calcium score for this patient, they don't order it unless you ask. Now, the fourth thing that makes this complicated is what I would call the unnecessary anxiety argument. Now, this one's a little weird for me. I've heard that some doctors believe that calcium scoring causes unnecessary anxiety. So they worry that if you get a score that's above 0, you're going to panic, you're going to freak out and worry, and you think you're going to have a heart attack tomorrow. And maybe that might be true for some people. But this is what I think. This is what I know. I am the type of person who would rather know because I'm somebody who will do something about it. I do not want to not know and then have a heart attack when I'm 65. I'd rather have the information and make informed decisions than to be kept in the dark because somebody thinks I can't handle the truth. So how do you get this test if your doctor won't order it? You have to advocate for yourself. So you can say, I'd like to get a coronary calcium score. I know my insurance may not cover it, and I'm willing to pay for it out of pocket if necessary. Can you write me an order? Most doctors will say yes, especially if you're over 40 or you have risk factors. But if your doctor says no, I'd recommend getting a second opinion. Or you can do what I did. I found a place that offers it directly to consumers. No doctor's order needed. I just scheduled it online, showed up, and got it done. I went to Harbor-UCLA in Los Angeles. Again, $200. Call them up. They're very nice. Ask them if they know of any deals. They might recommend a Groupon or something like that for you. There are places like this all over the country. You just have to look for them. But here's the thing. You have to remember, this is your heart. This is your life. You have every right to know what is happening inside your body. Okay, so the test. I go to Harbor-UCLA for my calcium score test, right? I walk into the imaging center, I check in, I fill out a quick form. They brought me into the CT room. They have me lie down on the table. They put the electrodes on my chest. They're just like this little sticky round pads, nothing invasive. They're just to monitor my heartbeat so that the scan can sync with it. The tech says, okay, just listen to the machine. The table slides into the CT scanner and it's like a big donut. Not claustrophobic at all either because your head doesn't even go inside. And the machine says like, deep breath in, hold, or something like that. So you hold your breath and the machine hums like 10 seconds or when that's when it takes the picture. And then it says, breathe normally or something like that. And it tells you like that you can resume breathing. And you do that like a couple of times and then you're done. That's it. basically a minute or so for the total scan. Then you get up, walk out, and go home. So after that, what happens? You wait. They say the results are going to be ready in 24 to 48 hours, and they give you a little QR code. But mine came quick. I actually got the email. I think it was in less than 24 hours. But during that time, I was worried. There was part of me that was hoping, okay, maybe the scale's wrong. Maybe my vascular age looked bad on the scale, but in reality, there's something weird that happened and I'm just fine. And that's really what I was hoping for. And of course, there was a part of me that was worried that there was actually going to be something going on there. Anyway, so I waited and tried not to obsess about what my score might be. Yeah, right. And then the email came and I open it and I download the PDF that comes with it. And I take a deep breath and I look at it and there it is. Coronary calcium score of 63. And I stare at it, like, wow, because I know what that number means because they give you a chart, right? I'm going to break it down for you. A calcium score of 0 means there is no detectable plaque. That's ideal. That is what you want. 1 to 10 means minimal plaque, so you just have a little bit. 11 to 100 means mild plaque, early atherosclerosis. That's where I am. 101 to 400 means moderate plaque, and over 400 means severe plaque risk. So my score of 63, it's in the mild category, which means it's like early atherosclerosis. But here's what really caught my attention. The report will break the scores down by artery. So the left main artery for me was 0. That's good. This is the main artery feeding the left side of your heart. You really don't want plaque there. Well, you don't want plaque anywhere. But in the left anterior descending, or the LAD, I had a score of 4. So I have a little bit of plaque there. The LAD is sometimes called the widowmaker because the blockages here are really very dangerous. So I'm grateful that this is low. Circumflex came back at 0, which is great, good. The right artery, 59. This is where the majority of my plaque is, almost all of it. So my plaque is not evenly distributed. From what I understand, this is not uncommon. For me, it's concentrated in my right coronary artery. So what does that mean? Honestly, I'm still learning, but right now, it tells me where the problem is and where I need to focus. Okay. And then there's the percentile ranking that this report gives you. My report said, compared to other women your age and gender, you're in the 80th percentile. And then it translates that. Translation is that 75% of women my age have lower scores than me. That means I'm in the top 25% for plaque burden. That is not where I want to be. Okay. I'm used to literally being the exact opposite. Okay. Because what you want to be is in the lower percentages for this, not in the top. So all my life, I've been in like sort of like the top 25% or higher when it comes to the body, my weight, my body fat, health in general. I do not want to be in the top 25% for plaque burden. I want to be in the bottom 25%, or better yet, I want to be at 0, but I'm not at 0. I'm at 63. So this is what this means. I have early atherosclerosis. I have plaque in my arteries. I have heart disease. So guess what? My scale was right. My vascular age is 67. It was telling me the truth. My arteries are aging faster than the rest of me because there's plaque in there. It's hardening my arteries. It's stiffening them. It's making them older than they should be. Okay, so when I got these results, I had a lot of feelings. The first was shock, of course. Even though I suspected there might be an issue, seeing it in black and white printed out on a report, it's very different. It's very real. It's very different than looking down on your scale and seeing your vascular age. There was also fear. I was afraid. I mean, what does this mean for my future? Am I going to have a heart attack? How bad is this going to get? Then, of course, there was anger. Like, how did this happen? I exercise. I've always been active. I've taken care of myself. I've never, ever had a weight problem. How did I get plaque? Now, for me, I have to be careful of this one because for me, part of my healing lies in compassion and forgiveness for anything I did or did not do that could lead to this happening. Then there was the grief. Okay, so I had to grieve. I'm still grieving that younger version of myself that had no plaque. But then something else happened. I started to feel determined and grateful. I'm grateful that I didn't find out this information while I was having a heart attack, and that I found it out while I was standing in my bathroom in Paris, France, stepping on the fancy new scale that I had had my eye on for years. I'm so grateful that I heard about this 30-second CT scan that confirmed what my scale said was happening while I still have options, that I found out while I still can do something about it, which means that now I have time, months, maybe years to slow it down, stabilize it, and maybe even reverse some of it. So after the shock and the fear and the anger and the grief, I decided I need to get to work. I wonder what would have happened if I had gotten this test at 40 or 45 or 50. Would my score have been lower than it is? Would it have been like 20 or 30? Or could I have caught this even earlier? Could I have prevented some of this buildup? I will never know. But what I do know is this: by the time you have symptoms of heart disease, so that's chest pain, shortness of breath, fatigue, the disease has already advanced. Okay. By the time you're having a heart attack, the plaque has been there for years, maybe decades. Heart disease does not announce itself. It doesn't tap you on the shoulder and say, hey, you might want to get this checked out. It's silent. It stays silent until it's not. And that is why I'm sharing this publicly. Because if you're watching this, if you're 40, 45, 50, 55, 60, and you've never had a calcium score test, please do not wait. Do not wait for symptoms. Don't wait for chest pain. Don't wait until you feel like something may be wrong, because by then it may be too late. I caught mine at 59. I wish I had caught it at 50 or 45. You still can. Go get the test. Find out. Know your number, because you can't treat what you don't know is there. So, what does a calcium score of 63 actually mean for me? It means that I have a higher risk of a heart attack or stroke than somebody with a score of 0. Now, how much higher? Well, it depends on a lot of factors from what I understand. So that would be my cholesterol, my blood pressure, my lifestyle, my genetics. The bottom line is that I'm at elevated risk. Now, that doesn't mean imminent danger, but it means if I do nothing, if I keep living the way that I have been living, that risk goes up. That plaque keeps building. The arteries will keep stiffening. And then at some point, maybe 5 years, 10, maybe 15 years from now, I could have a heart attack, or I could do something about it. And that's what I'm choosing to do. So for me, that means keeping my LDL cholesterol low. My LDL is already at the aggressive target, which is under 70 milligrams per deciliter, which is really good news. But here's what's interesting. Despite having good cholesterol numbers, I still developed plaque, which tells me cholesterol is only part of the story. There are other factors at play. So that could be inflammation, it could be insulin resistance, it could be possibly genetics. So keeping my cholesterol low is important, but it's not enough on its own. Okay, so starting statin therapy. So even though my LDL is already at goal, the statin helps stabilize the plaque that I already have to prevent it from rupturing. Now, that's what causes heart attacks. Not just plaque being there, but the plaque becoming unstable and breaking off. I also take a baby aspirin daily to reduce clot risk. So I'm also changing my lifestyle pretty aggressively. It includes diet and exercise and stress management and sleep. Because if good cholesterol numbers weren't enough to prevent this plaque from forming, I need to attack this from every other angle. So here's the thing. For me, this is not optional. This is not like, oh, I should eat healthier. For me, this is medicine. This is treatment because I have a disease. Yes, it's an early stage disease. Yes, it is manageable, but it is still a disease. And if I want to be here for the next 30 years and live those next 30 or more years like I want to live them, I have to treat it seriously. And that's what I'm doing. So some people may be watching this thinking, why is she sharing all this publicly? Like, this is private medical information. This is personal. You're right. It is personal. I am sharing it anyway, because this could save someone's life. Heart disease is the #1 killer of women. But most of those women who have died from heart disease, they didn't know that they had it until it was too late. I had 0 symptoms, no chest pains, no shortness of breath, no fatigue, nothing. Just a number on a smart scale that said that my arteries were 67 years old. And if I hadn't bought that smart scale, I wouldn't have known. And if I hadn't gotten that calcium score test, I wouldn't have known. I would have kept living my life the way I was living it, thinking I was healthy until one day, maybe 5 years from now, maybe more, maybe 10, I could have had a heart attack. And by then, the damage would already be done. So I'm sharing this because I want you to know you can look healthy and have heart disease. You can feel fine and have plaque in your arteries. You can be a very low risk patient and still be at risk. And you have the power to find out. You have the power to get tested, to catch it early, before symptoms, before a heart attack, before it's too late. That's why I'm doing this. So who should get a coronary calcium score test? Honestly, I think everyone over 40 should consider it, but especially if you have a family history of heart disease or have high cholesterol, or if you have high blood pressure, or if you have diabetes, or if you smoke or used to smoke, or if you're overweight, or if you have a sedentary lifestyle. But also, even if you're low risk, like me, even if you look healthy, like me, even if you spent your life, like me, exercising, eating well, and being known for being in great shape, because I checked all of those healthy boxes. I enjoyed being strong and flexible and having stamina, and I still have plaque. So my advice, get the test, know your number. You can't change what you don't measure. So that's my calcium score story. Now, in my next video, episode 3, I'm going to share my exact protocol that I personally am doing to reverse this. I'm going to cover the diet that I'm following, which is keto adjacent, heart healthy, what I'm eating, what I'm avoiding, and what I do. Remember, I live in Paris, France, about all that wine, cheese, and bread that's around here. And I'm going to talk about my exercise protocol, which is pretty much zone 2 training, what it is, why it's good for your vascular health, and how I do it here at home in Paris. And then I'll talk about my supplement stack, what I'm taking, why, and what the research says. Now, this is not theory. This is what I'm actually doing every single day because I refuse to accept this as a life sentence. Now, if you want to follow this journey, please subscribe and hit the bell. You'll be notified when episode 3 drops. And if you've had a calcium score test, tell me about it in the comments. Let's talk about this. Let's start building a community of people who are catching this early and doing something about it. Because you know what? We don't have to be statistics. We can actually be survivors. I will see you in episode 3.